There is one cheap little blood test, and I mean cheap, like the price of a large pizza, that can tell you more about your risk for heart disease, diabetes, cancer, and even Alzheimer's than almost anything else your doctor checks every year. And yet, if you walk into your next checkup and ask for it by name, there's a decent chance you'll get a blank stare, or you'll be told it's not necessary. Stick with me, because by the end of this video, you're going to understand exactly why this one number matters so much, and why so many people don't find out until it's already a problem. Picture this. You go in for your yearly physical, they draw some blood. A week later, the results come back and everything looks fine. Your glucose is under 99, so that's in range. Your average blood sugar marker, the A1C, is under 5.7, so that's fine too. Your triglycerides look okay. The doctor smiles, says everything looks good, and tells you to come back next year. This goes on for years. Then one day, seemingly out of nowhere, you hear the words nobody wants to hear. You have type 2 diabetes. And your first thought is, how is that even possible? I was just fine last year. Here's the uncomfortable truth. You probably weren't fine last year either. Nobody was looking at the one number that actually would have warned you early. That number is fasting insulin, and it usually is not part of a standard checkup. You can typically get it done for around $25 to $35 at a walk-in lab, sometimes less if you bundle it with other tests. Let's put that in perspective. The United States has spent well over $1 trillion since the early 1970s fighting cancer. That research matters, and progress has absolutely been made. But imagine if a tiny fraction of that had gone toward making a basic insulin test part of routine care. In 2025, total health spending in the U.S. topped $5.6 trillion, which works out to roughly $16,000 per person per year, babies and grandparents included. For a family of 5, that is real money, every single year. A lot of researchers believe that catching insulin resistance early, decades before it turns into full-blown disease, could meaningfully cut down on that number, because so much of what we spend on later in life traces back to this one root issue. So how big is this problem really? When labs look at optimal fasting insulin, most functional and integrative doctors consider somewhere around 2 to 5 to be the healthy target range. Depending on the population studied, a large share of adults, often cited as somewhere around 70 to 80% in the United States, run higher than that ideal range. And this is not just an American issue. Around the world, researchers estimate a majority of adults have some degree of insulin resistance without knowing it. So let's back up and talk basics for a second, because this is actually pretty simple once you see it. Think of insulin as the key that unlocks your cells so sugar can get inside and be used for energy. Blood sugar is just the delivery truck. Insulin is the guy who actually opens the door. Thousands of years ago, humans typically ate once or twice a day, so insulin knocked on the door once or twice a day. Today, between 3 meals, snacks, coffee drinks loaded with syrup and juice, many people trigger an insulin response 10, 15, even 20 times a day. Over time, cells get worn out from all that knocking, and just like a person who stops answering the door after being bothered all day, cells start to resist the signal. That is what insulin resistance actually is. And here's the kicker. When cells stop responding well, the body doesn't give up. It just makes more insulin to force the message through. That keeps your blood sugar looking normal on paper for years, even while insulin quietly climbs higher and higher in the background, doing damage the whole time. Standard checkups keep testing blood sugar, not insulin, so this entire process can run silently for a decade or two before glucose numbers finally start creeping up. Now, let's talk about why elevated insulin on its own matters so much for your long-term health, because this is where things get serious. First, chronic high insulin drives ongoing, low-grade inflammation throughout the body. Picture a car engine that never gets to shut off, just idling nonstop, generating heat and wear year after year. Short-term inflammation is healthy. It's how your body heals a cut or fights off a cold. But when insulin stays elevated long-term, that healing process never gets to finish, and the inflammation becomes chronic. Many researchers now consider this kind of low-grade inflammation to be a common thread running through the majority of chronic disease. Second, there's a real connection between high insulin and cardiovascular problems. Elevated insulin encourages your kidneys to hang on to more sodium, and sodium pulls water along with it, which increases blood volume and can raise blood pressure. Higher pressure over time can damage blood vessel walls, particularly at the little bends and turns, and that includes the tiny vessels inside your kidneys, which is part of why insulin resistance and type 2 diabetes are leading causes of kidney disease. On top of that, the inflammation from high insulin can irritate the inner lining of blood vessels. The body responds the way it always does with damage, by sending in cholesterol carried by LDL particles to patch things up. That patching process, repeated over years, is part of how arterial plaque builds up, and if a plaque becomes unstable, it can rupture and trigger a heart attack or stroke. High insulin is also linked to increased clotting factors in the blood, meaning blood can become a bit more prone to clumping, which adds another layer of cardiovascular risk. This is a big part of why many cardiologists today view insulin resistance as at least as important as cholesterol numbers when it comes to heart disease risk, if not more so. Third, joint health. Cartilage has very little direct blood supply, so it relies heavily on the surrounding fluid for nutrients. Chronic inflammation changes the chemistry of that fluid and can accelerate cartilage breakdown, while insulin resistance also contributes to weight gain, which adds mechanical stress on top of the chemical stress. That 1-2 punch is part of why osteoarthritis tends to show up earlier and progress faster in people dealing with long-term insulin resistance. Fourth, and this one surprises a lot of people, there is a real relationship between chronically high insulin and cancer risk. Chronic inflammation can suppress the activity of natural killer cells and other immune defenders that normally hunt down abnormal cells before they turn into tumors. On top of that, insulin itself is a growth signaling hormone, meaning it can encourage cells to divide more. Faster cell division means more opportunities for copying errors, and some research has linked chronically elevated insulin with higher risk for certain cancers, including breast, colon, and pancreatic cancer, especially when combined with high sugar intake. This is an active area of ongoing research, and insulin resistance is considered one risk factor among several, not a guarantee of anything, but it is a meaningful piece of the puzzle. Fifth, your brain. When brain cells become resistant to insulin's signal, they can struggle to take in glucose properly, even while blood sugar outside the cell looks completely normal. Since your brain makes up about 2% of your body weight, but uses roughly 20% of your daily energy, it is especially vulnerable to this kind of fuel shortage. Some researchers have started referring to Alzheimer's disease as type 3 diabetes because of how strongly insulin resistance in the brain appears connected to it. Chronically high insulin has also been associated with increased buildup of beta amyloid, the sticky protein plaque found in Alzheimer's patients. Sixth, body weight. High insulin promotes fat storage and actively blocks the breakdown of stored fat for energy, which is a huge reason why counting calories alone often fails long term. If your fat cells are hormonally locked, eating less without addressing insulin can leave you feeling hungrier and more fatigued, not less. This is part of why many people find that lower carbohydrate eating patterns or time-restricted eating, both of which naturally lower insulin, tend to work better for sustainable weight loss than calorie restriction by itself. Seventh, for women specifically, elevated insulin is strongly linked to polycystic ovarian syndrome, often called PCOS, which is one of the leading causes of infertility. High insulin can push the ovaries to produce more testosterone, which throws off the delicate hormonal balance and can lead to irregular periods, acne, excess facial hair, and trouble conceiving. And eighth, fatty liver disease, now the most common liver condition in the developed world, is closely tied to high insulin as well. Contrary to old assumptions, we don't get fatty livers primarily from eating fat. We get them primarily from the combination of excess sugar and high insulin, which triggers the liver to manufacture new fat from scratch, a process called de novo lipogenesis. All right, quick pause, because if you've made it this far, you clearly care about actually understanding your health instead of just being told everything is fine and sent home, so go ahead and hit that subscribe button. It genuinely helps the channel keep making videos like this instead of ones about, I don't know, ranking cereal mascots, and drop a comment letting me know your age range, because I'm curious how many of you in your 30s, 40s, 50s, and 60s have actually had your insulin checked. Okay, back to it. Let's talk about how type 2 diabetes actually develops, because the timeline tells the real story. Say at some point your fasting glucose is 85 and your fasting insulin is a nice healthy 3. That's a great combination. A few years later, your glucose is 90. Still technically normal, but your insulin might have quietly doubled because your body needed twice as much insulin just to hold glucose in that same normal-looking range. Since nobody is testing insulin, nobody notices. A few more years pass, glucose creeps to 95, still inside the lab range, still gets a thumbs up at your appointment. Eventually it crosses 101, just over the line, and now you're labeled pre-diabetic. If nothing changes, the typical progression to full type 2 diabetes takes somewhere around 4 to 5 more years. Notice how little the glucose number actually moved through most of that timeline, even while insulin was likely climbing steadily and doing damage the entire time in the background. That's the core problem with only testing glucose. It is a tightly controlled variable that barely budges until the system is already in serious trouble, which means by the time glucose finally flags as abnormal, insulin resistance has often been building for well over a decade. If insulin had been tracked instead, that slow climb would have been visible years, potentially even 2 decades earlier, giving plenty of time to make changes before anything became a real diagnosis. So why isn't fasting insulin part of routine blood work? It's not some grand conspiracy. It mostly comes down to standard medical guidelines, which were built primarily around glucose and A1C for diagnosing diabetes, plus the fact that insurance often doesn't cover insulin testing unless there's already a specific medical reason for it. That means many doctors simply aren't in the habit of ordering it, even good, well-meaning doctors who genuinely care about your health. So here's what you can actually do about it. You can ask your regular doctor to add a fasting insulin test to your next round of blood work, and plenty of doctors will happily do it if you ask directly, especially if you mention you're trying to get ahead of insulin resistance before it becomes diabetes. If your doctor isn't able to order it, most major labs allow you to order select tests yourself for a reasonable out-of-pocket cost, and it's worth calling around locally to compare pricing. Once you have a number, a general rule of thumb many functional medicine practitioners use is that the closer you are to that 2 to 5 range on an empty stomach, the better, though your own doctor is the right person to interpret your specific results alongside your full health picture, because context always matters, and this video is meant to inform you, not replace an actual conversation with your physician. If your numbers do come back elevated, the good news is that insulin resistance is one of the most responsive conditions out there when it comes to lifestyle changes. Reducing added sugar and refined carbohydrates, going for a daily walk, adding some strength training, and giving yourself a longer stretch overnight without eating, sometimes called intermittent fasting, have all been shown in research to meaningfully lower insulin levels over time, often within just a matter of weeks or months. None of that requires a fancy gym membership or a complicated meal plan, just consistent small changes stacked over time. At the end of the day, this comes down to one simple idea. Glucose tells you what's happening today. Insulin tells you what's coming in 10 or 20 years. And for the price of a large pizza, that's a pretty small investment for that kind of head start. If this video actually helped you understand your own blood work a little better, that's genuinely the whole point of this channel. So stick around, subscribe if you haven't already, and I'll see you in the next one, where we dig into another number your doctor probably isn't checking closely enough.